Welcome to Body in Balance Podcast. I am your host, Charlotte Johnson, the certified licensed physician assistant, sent here to kick some knowledge your way once a week for the purpose of educating, informing, and enlightening this audience concerning physical, spiritual, and emotional aspects of our bodies in relation to our Creator, the one, the only, the true and living God. He is the King of Kings and the Lord of Lords. Let us give it up for Yahweh.
Hey, good afternoon, good evening to some of you all on the West Coast, but we are doing a podcast and it's going to be on uncommon nosebleeds. Now, it was last week that I did it on common nosebleeds. And if those of you that follow me regularly, I want you to make sure that you contact other people and let them know about this medical podcast, because I tell you things that your doctor doesn't have time to tell you. I'm teaching you little tips to help you to stay healthy, to help you when there is a problem. A lot of times people come to the doctor because they don't know what to do. And that's what we're for, is to give you that information. So what I try to do is, because I know how healthcare is going, and it may be a struggle for some people. It may be a financial problem. And there's some little things that we can help you take care of, that I can help you take care of on this channel. So on my podcast, Body in Balance 25, is all about educating my people. And I want to give a shout out and a clap and everything to those of you that are following me. And there are at least 11,000 now. It's 11,000 followers on this channel. So I want you to make sure that you click subscribe and make sure that you hit that little bell at the top. That'll give you notifications for every time I drop a new podcast, I drop a new episode on some valuable information that you're going to need to help take care of yourself. In this video, in this podcast, I'm also going to put in a little video. I'm giving you information about what happens with the uncommon nosebleed. When you come in, there's exams, and sometimes there's something called a biopsy that you may need to find out what's actually going on. Let's just recap on last week. Common nosebleeds is usually a benign thing. It's not some kind of cancer or tumor. It is usually from dry nose. It's usually from dried crusted mucus in the nose. Or remember, I taught you about that nose picking. Most of the time that's with little kids, but you got some grown folks that will go way up there and start digging for gold. They may not tell you, but that can cause some nosebleeds. So we're going to talk about things that are uncommon. And I gave you the video. If you didn't see that video, you can check me out on TikTok, 25 Body in Balance. And since you're already on the YouTube channel, that's Body in Balance 25. You can check me out and go to either one of those areas and find my video on how to stop nosebleeds. I give you that information. I stood here and I shoved a cotton ball up my nose to help you guys be able to learn how to stop your nosebleed. These nosebleeds that are rare, they're going to be greater than 45 minutes. They're going to be 45 minutes or greater. And if that keeps happening, you really need to go see someone because there could be something going on. It's rare, very rare. So every time you get a nosebleed, don't start thinking you have cancer. Remember, I don't know, some of you all that are Christians, the Bible says that death and life is in the power of the tongue. So watch what you speak over yourself. It doesn't necessarily have to be cancer, but we're going to talk about those things. All right. So we're going to get an understanding of uncommon nosebleeds. We're going to talk about rare causes of nosebleeds, which is cancer and some other malformations of blood vessels and things like that. We're going to talk about the clinical features and the patterns of uncommon nosebleeds, some things to give you some signs and symptoms to go, maybe this isn't right. Okay. Evaluation and diagnostic workup for uncommon nosebleeds. Treatment approaches for rare causes of nosebleeds. Okay. We'll talk about all these different things. So what's this on the left-hand side as you're looking at your computer, looking at your phone, and you see it on your TikTok? What in the world are those draconian instruments that are going to go in my nose? Well, these are, the first one at the top is an to do an anterior rhinoscopy. So it's a nasal otoscope where you just stick it in the nose, and I'll show you as we go through. It just kind of goes in the nose. It doesn't hurt. It's a little bit cold sometimes when it goes in the nose, and then it just is going to be a spreader. So it's going to spread the nose open. So the nose opening, nose hole looks like this. It goes in there and it kind of spreads it out so that we can see and visualize better. You saw the lady on the first screen that had the light on the head. We use headlights. And so that gives us a brighter view. The other thing we use are endoscopies, nasal endoscopies. And we have a rigid type. The rigid type is this long metal scope here. Now you see on the end of it, there is a little, it can be hooked to a TV camera, and we can see and take pictures of what's going on in the nose. Now, what's the 0 and the 30? Man, I'm telling you, my audience is so intelligent. You picked right up on that. How come there's a 0 and how come there's a 30? Glad you asked. That's the angle that you will get when we're visualizing and looking at the nose. The 0 just looks like a big circle, like you can see my face in a circle. The 30 degree gives us an angle, so you can kind of turn it and look, and you can look down if you have had sinus surgery and there is an opening in the side of your skull where you can look through there inside your nose. You can look in there and see what the sinus passageway looks like. A 30 degree will help you with that. Okay. And then we have the flexibles, these long scopes that have the little camera on the end of it. And that we just slide it through. It just feels like a little spaghetti noodle being shoved in the nose. But we poke that in, and we can look around further in the nose. There's not as much pressure with the flexible scope as it is with the rigid scope. But when you're good at it, and if most ENTs, they know what they're doing, so it doesn't feel so bad. It looks bad, but it doesn't feel bad. We know how to do it. Okay, let's move on to the next slide. So definition and differentiation from common nosebleeds. I kind of gave you that information at the top. So common nosebleeds are at the anterior Anterior, which means the front part of your nose, that soft, mushy part that kind of holds up your glasses. It's before where you get to the hard part where the bone is. So if you can see, I don't know whether my cursor shows up, but you can see where the red area is. That's the anterior portion of the nose where most problems occur, where you'll see dry air or trauma. There's a misspelling on that, or trauma. That's from digital manipulation. Let's say that will be we will be politically correct and just say digital manipulation instead of nose picking. Okay. But that's also where those vessels I told you about were called the Kesselbach, Kesselbach complex or the Kesselbach plexus. It's a bunch of little blood vessels that look like the river. So let's look over here where it says the common nosebleed. You'll see that red triangle. That's the anterior nose, and that's where you'll find the Kesselbach vessels. And those tend to bleed pretty easily when the air is dry and when the nose has crusting, or if you have high blood pressure and your blood pressure is really high, then you can have that. Now you see how on the far right, there's a lot of little blood vessels all over the place. This is kind of the anterior nasal septum. So what's the nasal septum? For those of you that weren't on last week, you may not have, you didn't know. So what splits your nose is like a whole apartment complex. And then you have walls that split. Let's say it's not an apartment complex. Let's say it's a duplex. So on one side of the duplex, that's the left side, and the other side is the right side. This septum splits. That's the wall that splits your duplex. So in your nose. So you have two nose holes, and one side may be bleeding, the other side may not. Sometimes you get double-sided nosebleeds. All right. But uncommon nosebleeds, it's something deeper. It's something pathological. It's something way back. So when you go back over to this where it says systemic disease, that could be from some type of connective tissue disorder or something like that. Vascular malformations, and sometimes tumors grow back there. Now, go back and look at my video on polyps. You may see growths in there that are called polyps. Those are not cancerous tumors. Remember, those are benign. But if you keep getting nosebleeds, usually polyps don't bleed unless you keep picking at them. Okay? So, overview of rare etiologies: neoplastic or cancerous, malignant or benign growths that can cause epistaxis. Epistaxis, which is a nosebleed. There can be infection. We're going to talk about that. There's something called allergic fungal sinusitis. You can get allergic fungal sinusitis. Now, what you're looking at where it says infection, and you see the blue picture with the red or the pink look there, what you're looking at is if the skin is all moved away, and you could look in and see the frontal sinuses, which are up above the eyebrows. Your maxillary sinuses are your cheek sinuses, and your ethmoid sinuses are between your eyes. There's another sinus that you cannot see on this particular section. You can't see it because it can only be seen if the person turns to the side. So when you get a side view, the head splits and you can see it back here behind the eye. So if it's going like a perpendicular line running with a parallel line, it runs right together and they meet behind the eye, and there's a space opening back there. That's sinus. That is a sphenoid sinus. Now, when we're talking about these sinuses, with allergic fungal sinusitis, it's usually just seen on one side. So when you see that and you see growth or something like that, and there's a lot of bleeds, that may not be a polyp. It might be something called an inverted papilloma. Now, this is getting real deep. You don't need to worry about all of that. All you need to do is pick up the signs and symptoms and know if you keep bleeding, you need to go in and find out if you have any of these things that I've been talking to you about. Vascular problems. There are some vascular problems. You can look here and see if you have that hereditary hemorrhagic telangiectasia. There's going to be a lot of blood vessels and weird looking color to the inside of the nose. Now, the outside of the nose, if there is some type of blockage or malformation in arterial venous problem, if it's a venous problem, the nose is going to be real blue looking. If it's a arterial problem, it'll be bright red. And that's more of a hemangioma. Okay. So I'm giving you a lot of words because I know that my audience is really intelligent and you like to know these words. Plus, I'm still paying my school loans, so I need to say them so I can practice saying them. And it makes me feel good when I write that big old check to my school loan people. All right. Now, the systemic conditions that you could have would be like the connective tissue disorders and some other things. And I'm not going to get all deep into that. Okay. 50% of all the survivors from sinonasal cancers, you have a diagnosis if you have a 5-year survival rate, less than 50%. If you don't go and get that checked out early, then it's going to be a problem. This is why I have taken the time to dedicate time, because it takes time to get these lessons together. And I really want to make sure that they're good and clear for you to get a good understanding. But I want you to know when you need to run to the doctor and don't just sit home. And I'm talking to, I have a higher my analytics for the demographics of men is much higher than it is women. Men are the ones that usually sit home, and it's your wife or something that pushes you, or your girlfriend that pushes you, your significant other that pushes you to come and get help. So sinus cancers and epistaxis. Here's some of the early signs. Persistent or recurrent nosebleeds with unilateral, meaning one-sided obstruction. You'll get bloody discharge. So if you blow your nose and it's thick and yellow all the time, you probably have an infection, or it's thick green all the time, but you're getting some trace blood in there, like brown or bright red, reddish color, then you need to have that checked out. Tumor types and bleeding. You can have these different types of tumors. Just read over that. But then there's the exposure and prevalence in certain areas. Now, certain demographics are more common for having nasal cancers. Asian populations are common for having more nasal cancers. Those of you that live in the inner city, because there's so much chemical pollution and things like that. Those of you that are on farmers, you're around a lot of pesticides, you're around a lot of dust when you're baling hay or feeding the animals, and there's a lot of dust. So those occupations, those demographics, you need to make sure if you keep having recurrent nosebleeds, and it's not necessarily in the winter, you want to go get that checked out. Okay, infections. Now let's look at what you're looking at is a CT scan, and you're looking at a CT scan right facing the person. So this is called the coronal view of a CT scan. Now, everything black is normal. So let's look at the left one. Let's look at the No, the far right one. Let's look at the far right CT scan. You see where under the gray area, the big gray area, that's the eyeballs. So everything where there's something solid there is going to be gray or a lighter area. When you have space, it's black. So the cheek sinuses under the eyes and to the top of the teeth, those long white things, those are teeth. And then the look like inside the nose, when you're looking straight at it, you see the straight line that's gray that's splitting that townhome right between on both sides. And then it looks like a curled up shrimp there or a curly fry from Arby's. That's because I had some Arby's today. But anyway, you see that little shrimp looking thing on the bottom, that's called the inferior turbinate. So it's supposed to be there. Then you'll see just above that, that's the middle turbinate. It's supposed to be there. So when you use remember I was telling you about the scopes, the 30-degree scope, you can squeeze a 30-degree scope in there and get up to that middle turbinate. And with that angle, you can look to see if there's anything poking out. We can look to see if there's anything poking out or growing from that nasal sinus passageway. Okay. Now you can't get way up there usually with the scope. Now the flexible scope, you can get up to the middle turbinate and you can look around that second, just above the shrimp, and you see the little small gray thing hanging down. You can look up to that and you can see on either side of it. We can see on either side of it. We want to see that that's clear and there's no growth in there. Okay. Now look at the picture on the left. The right one was a normal one, and you see all that black space that's supposed to be there. But look at the one on the left. When you look at the left side of that person's face, or the right side, when you're looking straight at them, the right side is completely clear and it's black. But on the left side of that person's face, it's gray where it should be black. That's from chronic sinusitis or possible polyp growth. And that's why it is necessary not just to get a CT scan, but you need to have that nasal endoscopy. So don't go in there fighting your ENT doctor about, I don't want that in my nose. They've been doing it for years. They know how to do it. It's uncomfortable. It just feels weird. It feels like some pressure. You'll feel some pressure sliding in along that turbinate, but it doesn't hurt, okay? Bacterial and fungal sinus infections can cause erosions of the vessels and the mucosa, and that can make you bleed. That's why I said infections can cause bleeding. Okay, let's move on. So the role of smoking, chemicals, and radiation. All of these things that you see on this slide here can cause nosebleeds. They are causes of nosebleeds. So if you're a heavy smoker, 4 and 5 cigarettes a day, a pack a day, that's not good. So you want to make sure that you can stop that, because you're setting yourself up not only for possible lung cancer, but there's carcinogenics in that. Now, this goes for you vapors too. I'm not picking on anybody. I'm not judging anybody, but you can't do any better than you know how. So if I'm teaching you something, either take it with a grain of salt, or you can go in a corner and get mad at me. That's on you. All right. I'm just trying to help you. So symptoms and warnings: persistent unilateral bleeding. If you're only bleeding on one side all the time, constantly, every day for a week, couple of weeks, a month, you need to go get checked out. Bleeding with purulent discharge, like I just told you about the thick green, yellow, and thick white with trace blood and stuff like that, or a lot of bleeding in it, or you're getting a heavy duty clots and look like chunks of liver or something, you need to go in and be seen. Facial pressure and pain. If your face hurts, your top teeth hurt, your eyeballs feel like somebody's squeezing them or something like that, you need to go get seen. You may have a chronic sinus infection, but if you're getting that with nosebleeds, that's a red flag. Okay. If you're definitely having weight loss or you're having night sweats, then you urgently need to be seen. If you're having bleeding, facial pressure, colored mucus, and weight loss, night sweats, and decreased appetite. Now, associated signs in the rare symptom. Symptomatic findings is like I discussed: weight loss, feeling bad, running fevers, being hot, sweaty at night, decent. Now that you got to be careful and take that with a grain of salt for menopausal women. Those of you that are in your mid 40s to early 60s, if you're still having menses, but it's coming to the tail end of it, you can have, you know what I'm talking about, those private summers, even in the winter, or better known as hot flashes. Okay. That's not the same thing as running a fever. But if you're having nosebleeds with it, go see your doctor. Go see your friendly neighborhood ENT. Neurological findings. You can have some numbness or tingling in your face. Your top teeth can feel numb. Deep in the back, you may lose your sense of smell. Now, that was a big thing with COVID, but it was real important to be able to look in there and make sure that a person didn't have some type of tumor or growth. All right. I'm going to quickly go through these slides because I really want to get you to watching a little video with me. So, some of the core things that we want to initiate, we're going to get a history. Now, look, when we start asking you a lot of questions, I know you want to hurry up and go home and you just want us to just jump right in and just start doing stuff. But the history is so important. What you do, what you take. Are you using illicit drugs? We don't care because we're going to turn you in, but we have to have the information. So if you like to put nose candy in there, we have to ask you that question because we need to know, is that why your nose is bleeding? Is that why your nose looks like somebody's been, like a rat's been gnawing in there? Or is it from cancer that's chewing your tissue up? So that's why we're asking those questions. Okay. I just wanted you to know because some people get really upset about it. If you're having pain in the face, dizziness, and fatigue because you're bleeding so much, then we need to know that kind of thing. Smoking and all of that kind of stuff. That includes vaping and some of these, like I said, the nose candy is not nose candy, it's cocaine. But blood work is done to check for clotting factors, to see if something's going on, to check you for autoimmune disorders. And then we do a biopsy. This is where I'm going to take a little break and I'm going to load a video on the screen that I.
Nasal and paranasal tumors are abnormal growths that begin in and around the passageway within your nose. Nasal tumors begin in the nasal cavity. Paranasal tumors begin in air-filled chambers around the nose, called the paranasal sinuses. Nasal and paranasal tumors can either be non-cancerous or cancerous. Several types of nasal and paranasal tumors exist. Symptoms. Possible signs and symptoms of these cancers, often only on one side, include nasal congestion and stuffiness that doesn't get better or even worsens, pain above or below the eyes, blockage of one side of the nose, post-nasal drip, or nasal drainage in the back of the nose and throat, nosebleeds, a lump or mass on the face, palate, or top of the mouth, or inside the nose, constant watery eyes, bulging of one eye, loss or change in vision, pain or pressure in one of the ears, hearing loss, headache, trouble opening the mouth, enlarging lymph nodes in the neck, seen or felt as lumps under the skin, pus draining from the nose, problems with your sense of smell, numbness or pain in parts of the face, loosening or numbness of teeth. Causes: nasal and paranasal tumors form when a genetic mutation turns normal, healthy cells into abnormal cells. Healthy cells grow and multiply at a set rate, eventually dying at a set time. Abnormal cells grow and multiply out of control, and they don't die. The accumulating abnormal cells form a mass or tumor. If the abnormal cells become cancerous, they might invade nearby tissues and separate from an initial tumor to spread or metastasize to other parts of the body. Diagnosis: using an endoscopic camera to see inside your nasal cavity and sinuses. Collecting a sample of cells for testing or biopsy.
This is the biopsy.
Factors that may increase the risk of nasal and paranasal tumors include smoking and being around people who are smoking, breathing in air pollution, long-term exposure to chemicals and irritants in the air at work, infection with human papillomavirus or HPV, which is a common sexually transmitted infection. Prevention: to reduce your risk of nasal and paranasal tumors, you can stop smoking. Protect yourself from fumes and irritants in the air. Thank you for watching our video.
This video is produced by Body and Balance 25 for educational purposes with credit given to Medical Centric. Go ahead and click that subscribe button and hit the bell at the top for notifications. So I wanted to give a shout out to Medical Centric, CENTRIC, Medical Centric rather. You can definitely watch a lot of things on my channel, and then you can go to their channel too to check out some of their videos. I borrow some of their video pieces and add it in, but I want you to consider going to them, subscribing, and getting notifications from them also. Just want to give them a little credit, shout out. All righty. Let's go back. So I want to show you, do you see the little clamp over on the blue pad there? That's what they go in to do biopsies. Now, biopsies can be done in the office, but it depends on one, the color of it, how big it looks, and whether you're on blood thinners or not, whether your doctor wants to do a biopsy in the office. Because what you do want to do is make sure that you can control the bleeding. Whoa. Control the bleeding that you may have. You want to definitely make sure that there's not an uncontrolled bleed there in the office. So your doctor, even though I'm telling you they may do it there in the office, they may choose not to for your safety and take you to the OR to do the biopsy. Okay? So leave that option open. Don't go in there arguing with some ENT doctor in Vermont telling them, well, Miss Johnson said you could do it in the office. Some you can do in the office and some you can't. And they're doing that for safety reasons. So I told you why they say that they may have to do it there. Okay. Now, these are the instruments that I described to you at the very beginning that we may use. So some is for anterior and some is for posterior, where you can visualize better. The direct visualization with the endoscopies, either rigid or flexible. A lot of times they will use a rigid, because if you're looking with the rigid, then you have to use the other hand to get the biopsy. So that's why they do it with that. They may have to just go back further, and so they'll use the flexible because it moves around a little bit better, kind of snakes its way. I don't know why this is happening, but we're gonna fix that. It makes it snakes in there better for visualization. You may need to get imaging. Let your provider decide what imaging they need, because sometimes CT scans CT scans are more helpful. MRIs not as much, but it depends on if it's a vascular anomaly that it looks like. They may have to get an MRI or an MRA to look at the vessel, the blood vessels, how it's flowing. They may have to get the CT scan to see if it's a type of cancer and how they're going to plot out for surgical reasons. So I am giving you knowledge that your doctor sometimes doesn't have time to tell you. This gives you the knowledge to understand why we as providers decide we need a CT scan, we need an MRI, or we need the MRA. There are cost factors involved, but if it's a possible cancer, we need to know exactly where it's at and see what it looks like in certain different imaging. The reason we want to help make that decision is because for insurance purposes, sometimes if you go behind us and call and say, I don't want to have a CT scan, I want to have an MRI. I don't know why they didn't order an MRI. My cousin and your cousin is a financial advisor. They don't know whether you need an MRI or not, but they tell you that that's what they got. So you come back and try, don't do that. Now I sound like I'm fussing. So I'm not trying to fuss at you all, Body and Balance. I just want you all, audience, I just want you all to have the best knowledge and get the best thing and not get overrun. Because I've had people come in and do what I just told you, end up going, get an MRI, and then that's not what we needed. It didn't show what we needed. Now you got to turn around and go back. So you paid $2,000 for the MRI. Now you're going to pay another $900 or $1,000 for the CT scan when you could have got that in the first place. But anyway, let's get our wrap up here. Manage rare nosebleeds for better outcomes. These are the things you need to know and should have picked up from me on this. Consider cancers, infections, and environmental factors in any type of atypical presentation. Atypical presentation is recurrent nosebleeds, constant and unilateral. Identify key features. We do that. That's what we do. We identify key features. So why am I telling you this? Because that's not even your job. Well, I'm going to tell you why. Because I want you to be informed. I want you to understand. When you go to the doctor's office, while we're asking you a whole bunch of questions, and it sounds like we're getting all in your tea, we are, because we need to get that tea so we can take and understand what's going on with you, and we can categorize. Is it this type of disorder? Is it this type of disorder? We use all that information to decide whether you need a CT, whether you need an MRI, whether you need an MRA, whether you need to have a biopsy that day, or whether you need to have a biopsy after the CT. It's a lot of stuff that we are using that information for. And when you go in, I wanted you not to be so afraid of the instruments. And I told you they don't really hurt, but we need to be able to look inside your nose. We can't do any better than your regular doctor if you just want us to look in your nose with the otoscope. That's not going to help. We have to be able to get back there and see, look at the landmarks, make sure that there's no kind of signs back there. So please don't fight your ENT. You don't fight your heart doctor when you have to go in and get an EKG and they make you take your clothes off and put all these sticky things all over your body, or they make you get on a treadmill and run, and you don't like to exercise, but you got all these sticky things all over your body and you got to do it. Nobody fights the cardiologist when they want to know and get information. So don't fight your friendly local ENT when we want to do exams appropriately. We match treatments to the underlying cause and the way we can control the bleeding. Early signs and symptoms. If you have seen any of these signs and symptoms that I discussed today, 90%, 95% of nosebleeds are anterior nosebleeds and they're benign. It's no big deal. But it's that 5% that we're talking about today that I want to try and make sure that we can save a life. All right? So I brought to you all that I know how. Continue to support and work with me here on Body and Balance. I want you to make sure that you go through, look at my channel. I have it organized in different playlists so you can not have to fumble around. There's also the little shorts that you can look at on certain issues. Okay. I'm doing this to make sure that you know how to take care of your body. Hopefully, your horizons have been enlightening.